Hello, my name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to offer ways to accommodate an ear, nose, and mouth exam for individuals who need special assistance. Individuals with intellectual or developmental disabilities, often called IDD, may experience anxiety at the doctor related to the unfamiliarity with the situation or a past experience of difficult medical encounters. Lack of cooperation may be related to anxiety and can create challenges in examining some patients. First, consider how best to communicate. Verify potential differences in receptive and expressive language skills. Acknowledge accompanying caregivers and verify their roles. Key points in communication are: explain and demonstrate, speak and move slowly, use comforting language to praise cooperation, take 5 to 10 second breaks when needed, and re-explain using visual tools when needed. Begin with an explanation of the planned exam. Seek consent or assent. If there is hesitancy, demonstrate on a caregiver, a doll or stuffed animal, or by using a picture. Ask about potential aids which you may use for either distraction or incentive to ease and complete the exam. For example, a snack, a toy, or screen time might help. First, then language may be helpful. For example, first we do your exam and then you can have this sticker. If the person has difficulty, allow for brief 5 to 10 second breaks within an exam to help the person take a deep breath and relax. Ideally, your patient will cooperate by sitting on the exam table. You or the caregiver may need to assist your patient onto the exam table. Explain in simple language what you are going to do before you do it. It can be helpful to show your patient the otoscope and have them hold it or touch it. Some patients enjoy seeing how the light can turn the end of their finger red. Use your hand to study the person's head before inserting the scope. This may help minimize the patient jerking away and avoid undue pain. If you meet resistance, take a step back, re-explain the procedure in easy steps, and verify if some type of distraction or incentive may help. Demonstrate on a caregiver, a doll or stuffed animal, or use a picture. Then ask if you can try again. If the individual allows an attempt, praise cooperation, offer an incentive as previously agreed, and/or a 5-second break before moving on to the next side. Another technique to enhance cooperation is to allow an individual to sit on a chair or stand with their support person holding their hand or doing something else to help them relax during the exam. If you continue to meet resistance, reevaluate whether this exam is necessary at this time. Praise any attempt your patient has made, as they may be more receptive to the exam in the future if you have made an initial attempt non-threatening. Use the same techniques to examine the nose and mouth. Cerumen impaction is a common finding in individuals with IDD. There are several reasons for this, including differences in bathing or showering that do not allow water to naturally flush the ears, craniofacial differences including narrow ear canals or flatter canal angles, and spasticity. If possible, you should remove cerumen impactions to optimize your exam and to eliminate cerumen causing pain or limitations in communication due to secondary hearing loss. Many people with IDD will cooperate with cerumen removal as long as you explain why the procedure is recommended, demonstrate the tools you will use and what happens during the procedure, and give breaks as needed. When you have finished your exam, praise your patient for cooperating. Discuss the findings and recommendations with the individual and caregiver using simple language and providing time for them to ask for clarification or additional questions. If there is an emergency reason for the exam, sedation may become necessary. Thank you for watching. To assist your patients in preparing for an ENT exam, you can refer them to the partner video at forourhealth.org.